Have you checked your blood pressure recently and thought, it's only a little high, it's probably fine? That's exactly what worries many heart surgeons the most, because high blood pressure usually doesn't come with pain, warning signs, or dramatic symptoms. It works quietly in the background, slowly damaging your arteries, your heart, your brain, and even your kidneys while you go about your normal daily routine. What makes this even more dangerous is that many adults over 50 believe medication alone is enough. But according to heart specialists, there are hidden daily habits that can keep your blood pressure elevated no matter how many pills you take. Some of these habits happen first thing in the morning. Others happen late at night, right before bed. And one of them may be something you do every single day without realizing the strain it puts on your heart. In today's video, we're going to uncover the natural strategies many heart surgeons personally follow to protect their own heart health and maintain healthy blood pressure as they age. These are not extreme diets or impossible workout routines. They're practical habits backed by science and real-world medical experience. You'll learn which foods quietly raise blood pressure even when they seem healthy, the common evening routine that may spike your numbers overnight, and the simple circulation-boosting habits that can make a real difference over time. We'll also talk about the early warning signs many seniors ignore until it becomes a serious emergency. And make sure you stay until the end, because one heart-friendly nighttime habit discussed later in this video has helped many people wake up feeling lighter, calmer, and with more stable blood pressure readings in the morning. Your heart works for you every second of every day. The question is, are your daily habits helping it or silently hurting it? And a meta-analysis in the Journal of the American College of Cardiology found that ACE inhibitors and ARBs were associated with significantly lower new-onset diabetes risk compared to other antihypertensive classes. Before we continue, take a moment to think about this. Most people don't suddenly develop serious heart problems overnight. In many cases, the warning signs build slowly for years through small daily habits that seem harmless at the time. That's why understanding how your routine affects your blood pressure can be one of the most important steps you take for your long-term health. And if you found this video helpful so far, make sure to subscribe and turn on notifications. Every week we share simple, research-backed health tips designed especially for adults over 50, 60, and beyond. Our goal is to help you stay active, independent, and informed without confusing medical jargon or unrealistic advice. Now here's something many heart specialists emphasize, but most people rarely hear about. Blood pressure isn't only affected by stress or salty foods. It's also deeply connected to sleep quality, hydration, inflammation, and even how much movement your body gets during the day. In fact, sitting for long periods can reduce healthy circulation and place extra strain on the cardiovascular system, especially as we age. Another surprising factor is nighttime behavior. Many adults unknowingly raise their blood pressure before bed through heady late-night meals, poor sleep habits, dehydration, or excess screen time that keeps the nervous system overstimulated. Over time, this can prevent the body from entering the deep restorative state the heart needs overnight. Heart surgeons often say that consistency matters more than intensity. Small daily improvements done regularly can have a much bigger impact than extreme changes that only last a few days. Something as simple as a short evening walk, improving sleep timing, reducing processed foods, or managing stress levels more effectively may help support healthier blood pressure naturally over time. And coming up next, we're going to reveal one of the most overlooked habits linked to rising blood pressure in older adults, along with a simple adjustment that may help improve circulation, support heart function, and help you feel more energized throughout the day. For seniors already managing blood sugar or sitting in the pre-diabetic range, that distinction is clinically meaningful. ACE inhibitors do cause a persistent dry cough in about 10 to 15% of patients. If that's you, an ARB works through a similar mechanism without triggering the cough. Now, I want to describe two types of situations I see regularly that illustrate both sides of this conversation. The first is a patient in their late 60s on metoprolol for 4 years for blood pressure alone with no other cardiac history. Their energy has declined. Their fasting blood sugar has risen. Their weight has increased without any major lifestyle change. When we review their complete picture against current guidelines and discuss the option of a supervised transition to amlodipine, the conversation opens up in a way that simply never happened at any previous appointment. The second situation is a patient with a history of atrial fibrillation and hypertension. For that person, the calculation is completely different. The rate control benefit of a beta blocker for the rhythm problem changes the entire risk-benefit picture. Same medication, different patient, completely different answer. And this is the most important thing I want you to take away from today. Beta blockers are not universally wrong. For certain conditions, they remain the right and medically necessary medication. Coronary artery disease, a history of heart attack, diagnosed heart failure, certain arrhythmias. In all those situations, the evidence supporting beta blockers is solid and well established, and I'm not questioning it for a single moment. The conversation I'm having today applies specifically and only to seniors whose one and only diagnosis is uncomplicated hypertension, elevated blood pressure with no accompanying cardiac condition. If that is your situation, the question of whether your current medication reflects the best available evidence from the last 20 years is a completely legitimate and important question to bring to your doctor. Here's exactly what I want you to do with this information. 4 specific steps. The first step is to look at your current blood pressure medication and identify whether you're taking GA beta blocker specifically and only for hypertension. The names to look for are metoprolol, atenolol, bisoprolol, propranolol, and carvedilol. If any of those names appear on your medication list and your only diagnosis is high blood pressure with no heart failure, no prior heart attack, and no arrhythmia, that is the exact situation this conversation is about. The second step is to write down 3 specific questions before your next appointment and actually bring them with you. Ask your doctor, was my beta blocker prescribed specifically for blood pressure? And does that choice still reflect current ACC/AHA guidelines given my complete health picture? Ask, have we reviewed my fasting blood sugar, triglycerides, and HDL levels recently in the context of my current medication? And ask, am I a candidate for a supervised transition to a calcium channel blocker or an ARB, given what the evidence now shows for uncomplicated hypertension in seniors my age? Those 3 questions will open a conversation that is far more specific and productive than a standard blood pressure check. The third step is to request a formal medication review if your blood pressure prescription hasn't been formally reassessed in 2 years or more. This is not an unusual request. This is just good medical practice. Guidelines change. Evidence evolves. The medication that was standard of care in 2008 may not reflect what those same guidelines recommend in 2025. You are entitled to ask for a review, and any physician practicing evidence-based medicine should genuinely welcome that conversation. The fourth step, as any transition is discussed, is to confirm the tapering schedule explicitly. Responsible beta blocker transitions are done gradually over 4 to 8 weeks minimum. Your doctor should be monitoring your blood pressure and heart rate throughout that entire process. There is no rush, and there shall be no shortcuts. I also want to talk about what you can do right now today without changing a single medication. Because the lifestyle factors that directly support blood pressure control are genuinely powerful, and they're within your control starting this week. Daily physical movement, even just 20 minutes of walking at a pace that slightly elevates your breathing, has been shown in multiple trials to lower systolic blood pressure by 4 to 9 points. That is a clinically meaningful reduction comparable to the effect of a low-dose medication in patients. Reducing sodium intake to under 2,300 milligrams per day has been shown to reduce blood pressure by 2 to 8 points. And the DASH diet, which is high in fruits, vegetables, and low-fat dairy, was shown in a clinical trial published in the New England Journal of Medicine to lower systolic blood pressure by 11 points in hypertensive patients. None of those lifestyle changes require a prescription. None of them carry the metabolic burden of a beta blocker. And all of them compound with whatever medication strategy you and your doctor decide is right for your specific situation. I tell every patient the same thing. Medication is one tool in one toolbox. It is not the only tool, and in many cases, it is not even the most powerful one. The most powerful tool is the daily decisions you make about how you move, what you eat, how you manage stress, and how much quality sleep you get. Those decisions happen every single day. Medication happens once in the morning and then disappears from your awareness. The daily decisions never disappear. They compound quietly in the background of your health for years. Let me bring this all the way back to where we started. That exhaustion when you climb the stairs, that weight that keeps creeping upward, that tiredness that sits on top of every morning no matter how early you went to sleep the night before. If you've been attributing those experiences to getting older, that's completely understandable. Most of the seniors I speak with do exactly that. But now you know there is a specific, documented, well-researched reason why a beta blocker can produce every one of those experiences in an aging body. And you know that the current medical guidelines in the United States have moved away from recommending this medication class as the first choice for uncomplicated high blood pressure. You also know that there are well-studied, widely used alternatives with better cardiovascular outcome data, better metabolic profiles, and less impact on the exercise capacity and daily energy that determine the quality of your life at 60, 70, and 80 years old. You are not stuck. You are not locked into a prescription that was written years ago without question. You have the right to walk into your doctor's office with research-informed questions and to expect the conversation that genuinely reflects the current evidence. Your blood pressure matters enormously. The medication you use to manage it matters just as much. And you deserve a treatment plan built on what the science actually says today, not what it said 20 years ago. I'm Dr. Alan Mandel. If what I share with you today felt important, please hit that like button and subscribe to this channel. And please share this video with someone you know who has been on blood pressure medication for years without a single conversation about whether the current evidence still supports that choice. Because sometimes one video, one conversation, one question asked in a doctor's office at the right moment changes everything. Drop a comment below telling me the name of your blood pressure medication. I read every single one, and your question may become the next video on this channel. Thank you for trusting me with your time today. Your heart has been working for you every single second of your life. Through stress, long days, sleepless nights, and the natural aging process, it continues to carry you forward without asking for much in return. But as we get older, the small habits we repeat every day begin to matter more than ever. The good news is that supporting healthy blood pressure naturally does not always require dramatic changes. Often it starts with simple decisions made consistently. Choosing better foods more often, moving your body a little each day, improving sleep quality, reducing hidden stress, staying hydrated, and paying attention to the warning signs your body may have been quietly sending for years. Many people wait until a serious health scare forces them to take their heart health seriously. But prevention is always more powerful than recovery. The earlier you begin making heart-friendly choices, the greater your chances of protecting your circulation, maintaining your energy, and staying independent as you age. And remember, progress does not happen overnight. Healthy blood pressure is usually the result of steady daily habits, not quick fixes or miracle solutions. Even small improvements can create meaningful changes over time when practiced consistently. If this video helped you, make sure to subscribe and turn on notifications so you never miss our upcoming health videos designed especially for adults over 50, 60, and beyond. We're committed to sharing practical, easy to understand wellness advice that can help you live stronger, healthier, and with more confidence every day. And before you go, leave a comment below and tell us which one of these heart-healthy habits are you going to start first. Your experience may help encourage someone else who is trying to improve their health too. Take care of your heart, and it will take care of you.